It's a 25-year high, and we're not even halfway through 2019. According to the Department of Health and Human Services, anti-vaxxers are helping fuel the spread of measles through false information. DHHS says that includes spreading articles that say vaccines cause autism and other disorders. The Health and Human Services Secretary called vaccines one of the most studied medical products we have. Right now, there are no reported cases in Nebraska or western Iowa, but there are cases in eastern Iowa and in Colorado. Health experts are saying we all need to take precautions to prevent what was once considered an eliminated disease from spreading further. Reporter Phil Bergman talked to health experts about their recommendations.
Measles cases are on the rise. While they're not in Nebraska yet, the CDC is recommending people get checked out.
We know that there can be vaccine failures, and that's why it's important not just to protect individuals with vaccination, but to get the community vaccination numbers up.
We have vaccines that can prevent the infection, so I think prevention is the best route.
Dr. Renunga Vankanandan is an infectious disease physician at CHI Health in Omaha. She says those who get the vaccine have 93% immunity, 2 shots, and that goes up to 97.
In order for a vaccine to work, we all have to be vaccinated to produce herd immunity. So there's a lot of pockets in our country where there's vaccine rates have kind of fallen.
According to the Department of Health, there have been 4 cases of the measles in Nebraska since 2014, the last one in 2017. Prior to then, the last case was in the early 1990s. In Iowa, there are currently 2 cases in the northeast part of the state. Its first cases since 2011.
If you know you're immunized, then you're safe. You have the immunity.
Signs of the measles include a runny nose, coughing, conjunctivitis, spots inside your mouth, rashes on your face and body, and a fever. If not treated, it can get worse.
Once you get this viral infection, then you could get bacterial infection that can cause pneumonia, and you're in the hospital getting antibiotics, so you could get complications from that.
The United States is currently experiencing its largest number of measles cases since the disease was declared eliminated back in 2000. This is due in large part to anti-vaccine parents deciding not to get their kids shots. Dr. V says all of the data and evidence shows that parents should be getting vaccines for their kids.
As an infectious disease physician, I practice what I learn, evidence-based medicine. So for me, it's important to get vaccinations. And I also have a 5-year-old daughter, 2-year-old son. They are both vaccinated. I'm vaccinated, my husband is, so I believe in what I am teaching and what I am practicing.
Those born before 1957 are immune to the disease. If you're born after, Dr. V recommends talking with your doctor to see if you have the shot.
Some people, if they're really not sure about their immune status, might just elect to just get another shot and then get a booster shot, and then they'll be okay.
Reporting in Omaha, Phil Bergman, 3 News Now.
Yeah, if you're not sure if you've had a measles shot and lost record of it, Dr. V says one thing you can do is take a titers blood test. It checks if you have the antibodies in your body. She also says getting that extra shot to be safe does not have any negative effects.